I'm Dr. Prathiba, and today I'll be introducing to the fascinating specialty of oral and maxillofacial surgery, a surgical field that stands at the intersection of dentistry and medicine. By the end of this session, students should be able to define oral and maxillofacial surgery and understand its scope, outline the historical developments and key milestones in oral and maxillofacial surgery, identify the major clinical areas within the specialty, understand the training path and role of OMFS in patient care. Let's begin with a formal definition. Oral and maxillofacial surgery is a specialty of dentistry that includes diagnosis, surgical and adjunctive treatment of diseases, injuries and defects, including both functional and aesthetic aspects of hard and soft tissue of oral and maxillofacial region. The oral and maxillofacial surgery has a rich and fascinating history. In Middle Ages, the surgeries were mostly performed by barbers. Since then, the field has evolved tremendously and is currently at the forefront of advanced technology and innovation. The history of oral surgery goes to as early as 500 BC to 300 BC. The famous Greek physician Hippocrates described manually reducing the dislocation of mandible, indicating its long history. In 1210, the Guild of Barbers were created in France and split into two groups, where one group performed more complex operations and the other one were for the simpler procedures. Pioneers like Ambrose Paré, father of surgery, published collected works. It carried important information on tooth extraction and treatment of jaw fractures. In 1728, the oral surgeon Pierre Fauchet wrote a treatise called The Surgeon Dentist. The earliest man to be designated as an oral surgeon was Simon P. Hallihan. In the 20th century, there were giants like Chalmers J. Lyons, Matthew H. Cryer, Robert H. Ivy, who shaped the way the oral and maxillofacial surgery evolved from there. Father of oral and maxillofacial surgery, James Edmund Garretson is considered father of oral and maxillofacial surgery. He authored a book named A Treatise on the Diseases and Surgery of Mouth, Jaws and Associated Parts, which was first published in 1869. He has helped to establish oral and maxillofacial surgery as a specialty in the United States. Any discussion about the history of surgery in India is inevitably beginning with the reference to Sushruta and his contributions to the facial surgery. He is regarded as the father of Indian surgery, and he also stated that surgery is the first and highest division of healing art, pure in itself, perpetual in its applicability, a working product of heaven and sure of fame on earth. Sushruta taught and practiced surgery in the Bank of Ganges, and his contribution include the book he authored, Sushruta Samhita, 120 surgical instruments, 300 surgical procedures, 650 drugs, and he is also called as a father of plastic and cosmetic surgery. The conquest by the Arabs of the Indian province of Sindh, now a part of Pakistan, in the 8th century unleashed a scholarly exchange of scientific ideas, and this also led to the translation of Sushruta Samhita into Arabic and later into Persian. An operation using the skin flaps, for example, to repair the nose was described in the Sushruta Samhita by Sushruta. This procedure was observed in India by a British surgeon in 1793 and published in London the following year, thus changing the course of the entire plastic surgery in Europe. In India, Dr. Professor Mino S. Jinwala is regarded as the pioneer of oral and maxillofacial surgery in India, and he is regarded as the father of oral and maxillofacial surgery in India. In 1950s, Dr. Jinwala arrived in Mumbai following surgical training in Montreal, Canada, and set up a practice at the Nair Hospital. He is also part of the founding group of the surgeons of AOMSI, which is the Association of Oral and Maxillofacial Surgeons in India, in 1969. Oral and maxillofacial surgery traces its origin to the wartime medicine during the World War I and the World War II, where dental surgeons play a key role in managing facial injuries. Gradually, this surgical specialty evolved to combine the precision of dentistry and also the depth of surgical and medical care. At its core, OMFS is a bridge between dentistry and medicine. So the American Board of Oral Surgery was officially established in 1946 and was later renamed as the American Board of Oral and Maxillofacial Surgery in 1978. In US, the standardized residency requirements with 3 years of training were established in 1960s and later were changed to a period of 4 years. In India, however, the OMFS was formally recognized by Dental Council of India in 1974, establishing it as a vital branch focused on facial trauma, oromaxillofacial pathology, reconstruction and corrective facial aesthetic surgeries. Now let's look at the scope of OMFS. It has evolved far beyond extractions and minor oral surgical procedures. In the mid-20th century, we were probably practitioners of dentoalveolar surgeries working under very trying circumstances, and moving on to where we are today, the specialty in India has truly encompassed in all its scope, and that's how the journey of oral and surgery became to oral and maxillofacial surgery. Challenges in this maxillofacial surgery field is mainly because of the vastness of the subject. So because of this vastness, it requires intense training in both medical and dental sciences, and it also requires to have a solid ground in anatomy, pathology, systemic medicine to manage complex cases. To simplify this, Laskin attempts to address the problem by dividing the scope of maxillofacial surgery into three parts: areas of expertise, areas of competence and areas of familiarity. To be considered as an oral and maxillofacial surgeon, one needs to at least include the areas of expertise and areas of competence in his practice. Depending on the individual training received, the criteria that one establishes as their areas of competence or familiarity are interchangeable. However, these areas are the one that clearly distinguish the oral and maxillofacial surgeon from plastic surgeon or ENT surgeons, and help us to provide a unique treatment to the patient. This shows the scope of oral and maxillofacial surgery, with the foundation being the BDS, that is the dental undergraduate programs, and there is also early specialization into minor oral surgery, which falls under category 1. And category 2 is performing more difficult procedures, with category 3 being performing a complex maxillofacial surgeries. Coming to the spectrum of oral maxillofacial surgery. Minor oral surgery forms the foundation of oral and maxillofacial surgery, and these include extractions of impacted tooth, biopsies of suspicious lesions, frenectomies and cyst enucleations. Although considered basic, they demand precision and sound knowledge of the anatomy to avoid complications and to ensure optimal healing. So here I have shared some cases which depict some of the minor oral surgery procedures. Maxillofacial trauma. Managing maxillofacial trauma is a critical part of our specialty. We treat fractures of the mandible, maxilla, zygomatic complex and orbital bones. The goal is to ensure that there is proper restoration of the function as well as the aesthetics. So these are some of the pre and post images of cases which we have treated. Cleft lip and palate. OMFS plays a vital role in cleft care, along with other specialty, because treating a cleft patient is a multidisciplinary approach. Our focus is not only on restoring the appearance but also to restore the function, which is the feeding, speech, and also take care of the psychological well-being of the patient. Orthognathic surgeries, which are the corrective facial surgeries, involve correction of jaw deformities like forwardly placed jaw, backwardly placed jaw, if there is any functional disturbance, open bite, all those. And it's a transformative procedure that improves both the function as well as the aesthetic of the patient. Craniofacial surgeries and temporomandibular joint surgeries. This includes management of congenital deformities of craniofacial skeleton, the TMJ ankylosis, internal derangement, and even total joint replacement of your temporomandibular joint. It is one of the most technically challenging field, but is also the most rewarding aspects of our branch. Oncosurgery. OMFS surgeons contribute significantly to head and neck oncology by performing resections and oral cancers and reconstructive surgeries using flaps and grafts, usually performed alongside with oncologists and plastic surgeons. Aesthetic surgery. Facial aesthetic surgery is a growing and exciting domain within OMFS. It includes procedures such as genioplasty, rhinoplasty, scar revision, facial contouring, etc. What sets our specialty apart is that OMFS is the only dental specialty which is officially recognized by the Dental Council of India, DCI, to perform aesthetic surgeries. So Ratan Tata wisely told that if you want to walk fast, walk alone, but if you want to walk far, walk together. And that's exactly the mantra that we follow in our specialty. We work closely with multiple other departments for achieving the better results for the patient. We work closely with ENT, plastic surgery, neurosurgery, oncology, and even other departments of dentistry. Training in OMFS. The path of becoming an oral and maxillofacial surgeon in India is rigorous. It involves an undergraduate BDS program followed by a postgraduate MDS program, and there is no dual degree system followed in the Indian scenario. 5 years of undergraduate course in BDS followed by 3 years of post graduation in OMFS, that is the MDS, and followed by there are various fellowship programs available in the multiple subspecialties of OMFS, and also there is a option for PhD in the specialty. So coming to our university, Yenepoya University is a deemed to be university in Mangalore. It is a center of academic excellence and innovation in healthcare education. It is a multidisciplinary campus which houses various other institutes along with our dental college, the medical college, Zuleika Institute of Oncology, and nursing colleges. Because of this, it enables a strong interdisciplinary collaboration, which is the key for our branch. Our department of Oral and Maxillofacial Surgery at the Yenepoya Dental College has grown into a well-known and trusted center. We have a dedicated faculty members, 10 in number, who bring different strengths to the team. Our department also offers both undergraduate and postgraduate courses. We also guide PhD scholars. We give equal importance in our department for both the clinical work as well as the research, helping students grow in all areas. The infrastructure in our department, we have a very advanced minor OT which includes various state-of-the-art laser units, electrocauteries, piezoelectric units, etc. The dedicated major OT facilities are also available. We have an excellent radiology department where 3D imaging, cone beam CBCT can be done for diagnosis and surgical planning. Digital surgical simulators are there for the training of students. Virtual surgical planning, custom implant design with 3D printing integration within the campus is powered by the Yenepoya Technology Incubator. Also, we have a postgraduate training in the Advanced Surgical Skill Enhancement Division, the ASIN. To conclude, I would like to tell that the oral and maxillofacial surgery is a unique blend of dentistry, medicine and surgery, addressing trauma, pathology, reconstruction and aesthetics in the maxillofacial region. With evolving techniques and expanding scope, OMFS plays a vital role in comprehensive patient care, a specialty where skill meets precision and every case shapes a life. Thank you.